Ladies and gentlemen, we are back with Leaders at the Table. I am always excited, but even more excited today. Shruti, how are you? Welcome in. Welcome to
I
the Leaders at the Table.
yeah, I'm doing great. I'm your favorite guest, right, Cornelius?
Come through. Dr. Sheena, what do you think? Welcome back. What do you think about that? What comment?
Welcome back. We love Shruti and
Yes.
excited to have you here.
Today's episode and topic is patients, payers, and innovation, interoperability in healthcare, and healthcare accessibility. And so, as we always do with our guests, our special guests, we ask them to introduce themselves to us. Shruti?
Yeah. So I'm Shruti Kothari. I lead industry initiatives for Blue Shield of California. And what that means is when we think about healthcare innovation, our ecosystem is pretty fragmented. We have misaligned incentives. So in order to scale healthcare transformation, we really need to do work on building together. And sometimes that means building with our competitors and working with our competitors. So we call that co-optation. So at Industry Initiatives, we look at Blue Shield of California's transformation agenda. Where have we piloted and tested, or we're investing in programs, but there might be policy barriers or industry misalignments preventing the scale of that. So our team works with our internal business operation unit leaders, as well as external stakeholders. And yes, that also means other health plans who are traditionally our competitors to scale these programs. And so we have three focus areas. It's driving data sharing to advance the improvement of patient outcomes and care delivery. It's building a sustainable future for primary care through payment innovation. And it's also expanding behavioral health integration.
We love to see it. Dr. Sheena, you're back as always.
Hi, everyone. I am Dr. Sheena Menezes. I'm the co-founder and CEO of Simple Health Kit, and very aligned to the mission of healthcare access and making sure people that need care get care. And then the key of this discussion is data sharing. How do we make sure people get the data and data goes to where it's needed to make the highest impact? So excited to have Shruti on the conversation and share what we do.
Yeah, sure. So we feel like we're family, already a family. And so for our other members of our family, though, just give us your why. Like, what inspires you to do this work?
I've always been, a daughter of immigrants. My father passed away early, and my mom, sort of as a single, not college educated immigrant, was navigating all the systems, whether it's healthcare, financial institutions, so on. So just saw firsthand inequities and how hard systems are sometimes, and particularly in healthcare. And so my passion has always been fueled by this motivation for equity and this creating more just systems, and so on. And so when I look at kind of my career, I've been a health educator in vulnerable communities. I've worked on quality improvement, worked on developing innovation and venture funding innovation, and now scaling through the policy angle. And all of that really is, again, going back to my general why, which is just creating more just and equitable systems. But really, when I think about it, it's achieving industry-wide change in healthcare. It sounds so simple, but all of us working in it know it's not simple. And I've been most proud, I think, of trying to step outside of like, what is your typical, what is your normal, because it hasn't worked before, right? Like we keep trying to fix healthcare, and it's really a team sport, and I don't think we play together enough.
Awesome. Dr. Sheena, I know your story, not all your story, but some of your story. And Shruti was speaking, you mentioned your father. Is he part of your why as you do the work of building and leading Simple Healthcare?
Yes, Cornelius, I think that's I'd say similar to Shruti. I lost my dad at a young age, and I feel that rooted this inspiration of some of his last words were, go do something good, and kind of made it my whole career till day, figuring out how to make all the people aligned. So hard and complex, as Shruti mentioned, providers, payers, and pharma, incentivized, aligned to the mission of do something good for that patient. So what we've really done at Simple Health is, how do you take that human at the end of that needs that care, and then really try to align all of the parties to kind of make it work, where everybody, there's a win, right?
Shruti, one thing that I noticed, and you have an interesting lens for being a person as a health educator that worked on the ground with the people You've gone through being on the ground to working in health innovation from a venture capital innovation perspective and being in a plan. And this is just a question I had, just like, how do you take that connectedness to the community through all that so they can stay at the center of your work and your mind as you work through these very complex systems?
I think I look at my career as building blocks almost. So when, I became a health educator, it was very direct. I worked for the American Cancer Society, and I was working with hospitals and school districts and, city governments. But it was very individual, right? Like it's working with the communities, with the people, trying to get them in for their cancer screening rates, services that they need if they're going through treatment, things like that.
But at the center of it's a human, and we need to get out to understand what their journey might be. So Simple Health Kits products can speak directly to them, or interoperability as you work through your processes, Shruti, it can reach them at the end of the day and everyone can be empowered. So get into a little bit around the topic here of patient, payers, and innovation. Shruti, help us to understand the need for interoperability and also what that word really means within health system, payers, and patients.
Let's start off by saying, data sharing, interoperability, a statewide health information exchange, all of these, I understand. People kind of use all of these different terms, HIE. But at the end of the day, I really want to emphasize this. This is one of the most important things in healthcare. It doesn't matter if you are a startup, if you're a big system, if you are a venture capitalist, when we look at our healthcare system today and its inability to share data across our ecosystem, healthcare data is often siloed and the sharing is fragmented. And sharing data supports patients both at the point of care, at the population level. It gives policymakers insights into population level kind of health needs. And we saw during the pandemic, we saw states that did have the ability to data share, Nebraska, North Carolina, others as well, really publish how they were using their data sharing infrastructure to support, tracking of COVID, vaccination support, things like that. So, data sharing, it helps reduces, one of the biggest, I talked about equity and just systems. It helps reduce care disparities by tying the information to success and quality measures. It provides benefit to providers by having relevant information accessible when they need it. Payers are able to use data to drive population level insights and benefits. And so, it's really an essential component, and it's something that I hate using this word, but I'm going to use it. It's unsexy oftentimes. We don't really talk about it, but it is the foundation to almost anything that you can think of that's innovation, transformation, but also just basic foundations of operations as well.
Dr. Sheena, so one of the things I'm a couple of years back with the Simple Health Kit platform, you are able to collect all this data. You all had a heat map that could show you where the hot spots are as it relates to your tests being distributed across the country. And I was like, oh my, that is amazing to see, real talk. You have epidemiological data in real time as the sample hits your lab, and then you can then report it out. How does the platform work as it relates to data sharing? Because you have retail partners, you have payers, and you got to learn how to communicate this data with different types of systems. Give us a little insights around data sharing from a Simple Healthcare perspective.
Yes, thanks, Cornelius. Yeah, what we found out working with payers and even our providers, and is that just like you said, Shruti, it's siloed. So a payer would contract with maybe someone who does home healthcare, but then they have to send that outside to the labs, and then that data got lost. And did the labs make it to the provider? Did the results happen? And so we saw a lot of that fragmentation. And that really inspired us to say, hey, you know what? We're going to have a vertically integrated full stack platform that when we partner with the payer, we'll do the engagement, but importantly, provide that data real time. So when we worked with the quality teams, with all our different partners, they were like, we have to wait for our analytics team or even pay other brick and mortar labs to get that data back because they don't know where that data went. Did the person get screened for cancer, colon cancer? Did they get their kidney screened? So what we ended up doing is, one, we can integrate and connect with any EMR, EHR, Epic, eClinicalWorks, Athena. So we're all connected in that ecosystem, but we also have the labs. So as we get the data and as we're closing these gaps in care for all these different conditions, we're providing real-time feedback to the payer to the provider, to the patient, down to the individual. So you know different lines of business, different population, different ethnicities, because you also can learn who's not engaging, who's not coming to the table when it comes to some of their programs. And then we're able to target it in saying, let's do an activation, let's get those communities engaged in that ecosystem. So we've listened, learned, and now that data is so valuable for multiple, even our pharma partners, and like always de-identify, but we can actually do real change and really addressing heat maps or populations that have huge disparity. And that's one example of what we do with some of the data we are receiving real time. But our payers love us. One of our national payers said they wait 2 months sometimes just from analytics. And now their quality managers are able to see real time what's happening to their population and their programs they're deploying.
So data sharing at the end of the day, as Sheena would say, net is extremely important. And we need to, lean into it. Sheena, I'm going to use all your words, but lean into it. How are healthcare leaders, especially providers and payers, committing to data access? What does that look like, Shruti?
Yeah, so for data sharing, that's a perfect example of how we as payers are working with other organizations and providers with the common mission of having data sharing in our state of California, which is, as you know, pretty mighty state over here. We're active members of the Connecting for Better Health Coalition, which is a nonprofit, and it's dedicated to realizing the full potential of health and social service data sharing in California. And the membership includes organizations from across healthcare, from other health plans, patient advocacy groups, hospitals, providers, venture, startups, sort of you name it, like everybody. And, we do things like, for example, we recognize that policy is a powerful lever for change. So our team recently advocated for SB 660, which establishes a more robust system for sharing health and social service data across the state. And I think, for folks listening on this, whatever state you're a part of, there will likely be some movement around data sharing. If you are in the state of California, we'd love to have you join our coalition, Connecting for Better Health. Timmy Leslie leads that coalition, and I know she'd love to hear from you. But if you're in another state, I'm sure there's efforts also happening in your state for data sharing as well. So that's something that you can kind of look towards. And I will say, I've been at Blue Shield of California for almost 5 years now. The time has gone by pretty fast. And I have we continue to work on amendments to make it more and more operable. But I say this to say really passionate people, and really proud to be a part of Blue Shield of California, who's also always really been at the table for this.
Awesome. Thank you for the work that you're doing in that regard, and your team members as well. Sheena, I just want to kind of kick the ball over to you a little bit around data sharing and revenue, right? So when we think about data sharing, doing the good work in the community, and coupling that with a revenue generating company like Simple Health Kit, like how is that data sharing helping you all to be that revenue generating company? So example, okay, you got here doing the good work, you're distributing test kits in Sacramento to patients and population. How is that helping your customer, i.e. the payer, understand like, oh, this is good. By them doing good work, is helping us. So we want to buy more of these test kits so they can distribute. Could you just walk us through that kind of case study? Because I want people to see the correlation between the two.
Yes. So when we work with payers, they want to close those gaps in care. They want to improve those HEDIS measures. The more utilization they're getting, the more dollars they're either saving or making on the front end, right? They're saving it if that person doesn't go to the ER for chemotherapy or dialysis. And so by identifying early detection, now we're helping that patient be healthy, but we're also saving dollars on the payer end, and we're getting them that data back. So there's compliance, there's cost savings, there's improving clinical outcomes, members are happy, everybody wins. So honestly, I love the business we're in because it's a win-win. We're helping patients get early detection, payers win on saving and making money. And now for the first time, they're not having to work with 20 people to get that data. And at the mercy of every gap that gets dropped with, who do I send the labs to? Who's going to do engagement? Who's going to give me my data at the end of the day? And so when we're vertically integrated, we made it that this is just going to be streamlined. Like The payers, just give us the members, we'll get them care, or providers, we'll reach people who don't have care, because we know the stats. 40% of people they don't have accessibility to either a primary care provider, and they're getting dropped. And those can be costing the payers lots and lots of dollars on that other ecosystem. So we found like a perfect niche where we can make everybody win in the ecosystem. But what ties it together is the platform and that data back, because without that data, they cannot go and, get their revenue goals met on that front.
So you can do good and make money at the same time.
Well, actually, that's an important question, because it is one of those things of the business line item for a startup or a venture capitalist to care about this topic is actually quite high. If you are, I worked with over 30 companies when I was at Kaiser's Venture Fund, and data sharing was an issue. Like our broken systems around data sharing was an issue for every single one of them. So when you think about that, if you're an operator of a startup, you should care about this topic. You're going to come face to face to this at some point if you're in healthcare. If you're a VC investing in companies, this is a big problem. Like your profitability and rate of return on that company is going to be dependent. So I say this again, just to say it can feel like I think more and more people are realizing that, but traditionally it's been more of a wonky topic that people don't realize how it does impact their bottom line. So Sheena, that was it was wonderful for what you just said, but I want people to really hear that, because we want more and more people to join this fight of data sharing, spreading it.
Good stuff. I love that. I'm like, what was that Eddie Murphy, like Hercules? But anyways, I think that's another person. Let me stay on topic. We got to close out. I think we're about to close out our time here with you, Shruti and Dr. Sheena, but just to end up with a couple more questions. Can you share more about your nonprofit, Women in the Community, Shruti?
Yeah, Women of Community. I started this organization in 2020, and it was at the time when we were asking, so essentially McKinsey does this annual report on women in healthcare, and it found that only 4% women of color were senior leaders in healthcare. And, big hospital systems, health plans, like a lot of different folks were included in this survey. And when I think about how many women of color are frontline staff, either clinical or not, how many women of color are caregivers, either paid or family, and the health disparities that exist for women of color, having only 4% women of color as senior leaders is not enough. And it was at a time also when there was an election and we were asking women of color to get their communities to turn out and vote. We were asking women of color to get their communities to mask up, to get vaccinations. So a lot of the free labor that women of color do, because they are these pillars in their community, right? And we don't see that representation in our leadership who are making decisions at the table. And so I was pretty heated and fired up about it. And I started Women of Community. What we do basically is we work to increase representation of women of color in senior leadership in healthcare. And what that looks like, I asked one of the heads of HR at one of the largest hospital systems that was included in that survey, what prevents women of color from, being leaders. And she said they have no problem recruiting women of color on the top and on the bottom. It's the whole middle pipeline that oftentimes women of color are at the intersectionality of a lot of different things, don't see themselves in the next level of leader, manager, director, as you move forward. And so they think, I don't want to take on another thing, or I don't see me represented in that. And so they themselves up for roles too. And then you have other things like biases that create in the systems. So we decided to focus our efforts on elevating stories and narratives of people who are in those roles, of creating forums where we get together and hear these stories. We just did an event with UC Berkeley School of Public Health where we had amazing folks like Ceci Oregon, who runs Kaiser Permanente's Health Policy Institute, and GM, who runs community health at Common Spirit, just from across the spectrum, talking about these real challenges when you're at the intersection and how you move forward. So for folks out there, if you're interested, you should join our mailing list. We're on LinkedIn and on Instagram at Women of Community.
Women of community. Well, thank you. I think you have one here with Dr. Sheena.
I want to join that.
I was about to plug
I missed
you.
the last one, the Barry workout. But,
Yeah.
Oh yeah, we had
I hurt my knee.
Yeah, thank you to Barry's who gave us a Women's Day class.
Dope. That's dope. Dr. Sheena, I'm gonna call you out, ma'am. You just got recognized recently for being a leader, a female woman leader in healthcare. Right? You want to share a little bit? I put you on the spot. You know, you don't like talk about stuff like this, but I want to pull it out you anyway.
To push the, for the purpose of this space of women or community, yes, like, top female founders, fierce, most influential minority leader.
Uh-huh.
And I'm going to accept that, because I think that's another thing women tend to do is like, we don't,
Yes.
I'll accept it for the purpose of this space. But beyond my, me on the spotlight, it's really the team and the reasons why we're fighting for what we're fighting for today is really bringing other people up as we go up in that table, reach places that we keep growing, and making sure that, the credit really goes for the people and the team behind that, like, pushes us to drive forward.
All right. Well, we appreciate your good work, ma'am, and your leadership. Thank you, Shruti, for your leadership and your why. Ladies and gentlemen, this concludes this episode of Leaders at the Table. Thank you so much for joining us. We see you soon. Take care.